And if we're kind of treating those traps, like I said before, a lot of people, if we're doing any sort of like ART type passes or anything like that, we're going to be getting people pulling out to the side. But if we feel with our hands, there's always a lot of tension coming back up towards the neck. So we're going to try and hit up that area with him here. So, very simply just coming towards, and again we're just using that superficial edge. The traps aren't as thick of a muscle as everybody thinks they are. So that's the first pass there, and if we're completing everything in the neck, what we'll do is we'll take this, and since he's kind of bunched up, we're going to take a little bit of that skin slack away so we can actually get in him. And we're going to bring those paraspinals up towards the skull. You okay, bud?
Mm-hmm.
I'm using more of that edge number 3, or the point number 3 on here, because it's a very thin muscle. So we don't need that big broad stroke or anything like that. Good. And then if we're getting those suboccipitals, again, it's going to be a little bit difficult with him here. I'm going to show you guys with him on his back as well. We'll get the other side. The suboccipitals we can kind of bring, and we can start working towards the midline instead of pulling away. So pretty much right against the base of the skull there we can feel. So we don't want to put too much pressure onto the base of the skull, but just those suboccipitals we can start working back in that direction there. And it's a very small movement because they're not very big guys in there at all. You can probably tell it feels a little bit different when we're working towards the spine than when we're kind of pulling away. Okay, it's pretty basic. I'll show you how to do it on his back as well when we get there. Just because on a table like this it might be easier to kind of just turn his head to the side and do it that way. The traps aren't too bad doing them on here. I like doing them face down just because we can really get a lot of pressure through them. Let's get you on your side for me, Max. Just facing that way over there. Perfect. So here we're going to treat a little bit of his lats that are coming down through this area here. Okay. So again, with them nice and relaxed, we can go through some general passes down those lats. See if there's any restrictions in there whatsoever. And then I'm going to get you to lift your arm up, and we're just going to kind of rest it up there. So now we're going to lengthen those lats a little bit. Okay. Now we can get in there quite a bit deeper and trace them all the way down into that thoracolumbar fascia and the bottom down here. Then we can even take a little bit of control with them here. Almost pin down the tissues. Just move them through a little bit too. Okay. The pinning technique isn't one that I use a whole lot on a lot of body parts other than the lat, but I like to get some of that movement in while I'm pinning down specific structures in there.
What edge do you use on that?
We're using 35-degree edge number 1. So, and then we can even start moving through as we're pulling them up. So really getting the full length of that muscle in there. Cool? You alright?
Yep.
Okay.